Good afternoon. My name is Dr. Jack Lambert, and I'm welcoming you all to the Crypto Infection Conference, Lyme disease and other hidden infections, a One Health approach. And this is the second international conference in crypto infections. The chair for the conference is myself and Christian Perrone. I'll be chairing the first half of the day, and Christian will be chairing the second half. What I'll be doing is presenting a 10-minute introduction of slides. Gordana, who is the coordinator of the project, is going to give you a few details on how to use this virtual computer system, and then we'll move on to the main speakers. Okay? So the introduction here, I'll just start and then take it from there. So crypto infections, basically crypto infections are infections caused by intracellular occult pathogens, which then serve as direct target for the immune response. So cryptic infections, crypto infections, Dr. Perrone and I have a difference in the spelling sometimes, but I think the important thing is many unrecognized infections or conditions may be a result of such infections, and we need to do better in terms of our ability to diagnose and treat these infections. Next point, our next speaker will be discussing this, but the One Health initiative is really a critical component of these crypto infections, tick-borne infections, because ticks bite animals and humans, and we need to kind of join up our thinking to be better able to, understand the pandemic of zoonosis worldwide. And this is just a slide showing the different emerging and re-emerging infections. Some of them tick-borne infections, some of them, but 70% vector-borne and 30% zoonotic. So the importance of a One Health initiative to tackle these problems. This is just a slide showing the Irish tick study we did a couple of years ago. The common opinion in Ireland, there are no ticks. The ticks don't carry Lyme. There's a huge misunderstanding of the epidemiology of tick-borne infections. And this just basically, one of my colleagues went out and picked ticks from 6 different locations in Ireland, identified between 2% and 12% of the ticks positive for Borrelia, not the American Borrelia, the European Borrelia, and one was positive for Miyamotoi. So just kind of giving us some strength that, in our scientific understanding that people are out there getting tick-borne infections with Borrelia. The numbers are higher, obviously, in other European countries and in America, maybe 70% if you're in old Lyme, Connecticut, but 2% to 12% is not zero. And patients are getting infected with tick bites, with Borrelia and other co-infections, which we don't currently test for in Ireland. This is a UCD veterinary study, and they basically picked ticks from a number of different locations from animals, and they found, this doesn't project very well, but basically they found Borrelia, Anaplasma, and Babesia in the ticks around animals throughout Ireland, from the north to the south to the east to the west. And it's likely if these infections are prevalent in the animals in Ireland, they're probably prevalent in the humans, although there's no recognition that Irish patients can be infected, not just with Borrelia, but also other co-infections. And this is just a slide summarizing some of the tick-borne pathogens. So it's not just about Lyme. Lyme may be a focus, but I think polymicrobial infections are the critical, kind of concept that we need to kind of deal with. This was one of my first observations when I saw patients about 5 years ago, and I had one of the medical students write up. I looked at the first 100 patients that I'd taken care of who actually had negative antibodies to the standard Irish Borrelia tests. And they were kind of coming to see me, where there was a high suspicion they had a tick-borne infection, and they'd been given a diagnosis of chronic fatigue syndrome, fibromyalgia, some atypical neurological symptoms, atypical infections. This was the diagnosis before they saw me. But the reason I saw them is I selectively chose them because I suspected an underlying tick-borne infection. And then this is just the antibody tests that were done on them. And obviously, patients have viral infections, and antibody doesn't mean active infection. It means either an active infection or a past infection. But just interestingly, 23% or 23 of this 100 were positive for anaplasma, despite being negative for Lyme. And then a number of them were positive for other tick-borne infections, including rickettsia, Q fever, babesia. So this just actually kind of led me to kind of pursue this further, treat some of those patients with combination antibiotics covering Lyme and some of the other co-infections. And basically, this is an experience that other clinicians have. Unfortunately, these data don't get published, but about of the 71% patients who actually received the treatment, almost 70% responded in terms of clinical improvement, standardized, quality of life assessments, clinical improvement. So this was really one of my first observations that these patients may have had anaplasma, other infections similar to that. Clearly, they must have had a tick bite in the past. They had signs of active infection and they responded to antibiotics. Why they responded to antibiotics? That's the challenge. So moving forward then, where there's lots of research priorities moving forward with tick-borne infections, and we've established a Lyme Resource Centre that's registered in Scotland with the idea of pursuing some of these questions regarding tick-borne infections. And the Scottish one, is specifically as to identify all the tick-borne infections in Scotland. And there's some recent data on babesia in the animals in Scotland that's been published. How many humans have it? We need to know. So we need to kind of establish the burden of tick-borne infections throughout the European Union and worldwide. It's not just about Lyme, it's often about co-infections. And we need to kind of have better understandings of when you do treat these people, whether it's with herbs or combination antibiotics or whatever, what is the optimal treatment and what is getting these people better? And then finally, lots of patients are going to non-pharmacological interventions because they're not offered the opportunity for antibiotic therapy beyond the standard 2 weeks of doxycycline. And many of these treatments are working. So we actually need to research better to have a better understanding of how these kind of non-antibiotic approaches are working. And then I'm not going to go through this in much detail, but the reality is that these infections are it's not just about Lyme disease, it's likely polymicrobial. The number of people who are being infected are not currently being accurately evaluated. For example, in Ireland, they report about 20 cases annually because you need a spinal fluid result to be counted as Borrelia. And then they say that maybe 200 cases. We've done an estimate in Ireland, and we think there's probably 2,500 of Borrelia, not 20. So there's a need to kind of have research priorities in terms of better understanding persistent infection, better understanding the relationship between animals and humans, and better understanding what the other aspects that are involved in getting people better who have these chronic polymicrobial infections. So like I said, the theme of this conference really is looking at the relationship between animals and humans, looking at polymicrobial infections, and we need better science, and that takes research and that takes monies. So that's the challenge that we hope we can have solutions for at the end of 2 days today.